Lord knows I love some good soul food. And having too much of it, though, can certainly increase the risk for heart disease. The risk factors become much more prevalent when it comes to the black community. That's according to several doctors. So joining me here this morning live to talk about how you can curb this, how you can make yourself healthier, is influencer and doctor. First of all, he's a cardiologist and medical influencer, Dr. Eddie Hackler III. Good to see you, my brother.
Good to see you too. Thank you for having me.
Okay, so when it comes to heart health issues, specifically in the black community, why is this such an issue?
It's such an issue because not only is heart disease the #1 killer of all Americans, it's the #1 killer of people in the world and of all people. But for black people, specifically in the black community, the risk of heart disease is even higher. And some studies estimate that black Americans are at least 30% more likely to die from heart disease than white Americans. And that's all heart disease. So that's strokes, heart attacks, heart failure, hypertension, peripheral artery disease. And even further, a lot of black people have heart disease at ages that are a lot younger than their white counterparts.
What are some of the contributing factors to this issue in the black community?
So the biggest, I think, contributing factor is social determinants of health. And what these are areas of life that are critical to the health and well-being of people. And they can be grouped into economic stability, so income and employment, education, so literacy and higher education, food, access to healthy options, specifically like food deserts. Food deserts are predominantly places where people don't have access to healthy foods. And a lot of these are high in the black community. Healthcare, so having good coverage, access to quality doctors. Your community plays a huge issue as well. So social injustice and discrimination, and even your neighborhood. So the type of housing, if there's parks and playgrounds around, the transportation that's available. Imagine trying to go to a physician and you don't have the transportation to get there. Then how do you go from there? Yeah. And certain studies even show that your zip code or where you live has up to a 60% impact on your actual health.
Yeah, so a lot of factors there. So what are some ways, what are some things you can do to combat against this issue to ensure that your heart is healthier?
Yeah. So I think from an individual standpoint, the biggest things, your diet. So making sure you're eating a healthy diet. So there's a DASH eating plan that we love in the cardiovascular space. That focuses on foods that are low in sodium, and then also exercising regularly. The American Heart Association recommends at least 30 minutes of moderate intensity activity at least 5 times a day. 5 times a week. So that's at least just brisk walking. Of course, not smoking, limiting alcohol, maintaining a healthy weight, and then also doing everything else that you need to do.
Yeah, and I know you have built a brand on social media for people who need to follow you, look out for you, I should say. The Black Doctor on Instagram, Twitter, and everything. You spread knowledge to people on how to make sure that your heart is healthier.
Yes. That is what my sole purpose is. And I also teach people different ways that they can keep their heart healthy, and also teach people about the different cardiovascular diseases that affect people in general. So a lot of people don't know about a lot of different diseases, so yes.
All right, so Dr. Eddie Hackler III, cardiologist. You can find him on social media at The Black Doctor. He spreads a lot of knowledge on to make sure you live a healthy lifestyle. So good to see you, brother. I appreciate you.
All right, thank you for having me. Take care.